Hello, and welcome to Riverside's Heart Month lecture series. In honor of Heart Month, Riverside is excited to be presenting a new community lecture on a different cardiovascular topic each Thursday this February. Today, we'll be focusing on the cardiovascular impacts of COVID-19. Three cardiologists from Riverside Cardiology Specialists are joining us to talk about what has been learned over this past year and to share some information on how COVID-19 impacts and presents in the cardiovascular system. First up, we will have Dr. Ed Chu and Dr. Charles Vaughan, and then we will hear from Dr. Alexandra Ward. As a lot of information will be covered, we will have a key summary takeaway at the end, but as it's a video, you can always rewind and hear any section again. So without further ado, I will turn it over to Dr. Ed Chu and Dr. Charles Vaughan. Gentlemen.
Welcome to this presentation for our February Heart Month. Dr. Vaughan and I and Dr. Ward later will be talking about COVID and its impact on cardiovascular disease. Unfortunately, this disease has been certainly the pandemic of my medical career with tremendous involvement involving the United States, some 26.5 million cases, over 440,000 deaths. And unfortunately in Virginia, it's one of the leading causes of death. It was 65,000 deaths. I think one of the most common questions we have is what type of medical disease do I have that really predisposes me to this severe respiratory and cardiovascular illness? And I think that hypertension, coronary artery disease, and heart failure of any type is probably the three most common and most concerning medical conditions which really heightens both your awareness and your need to practice social distancing. And see the disease manifestations can be quite severe and has an increased risk of both complications and death should you get exposed to this virus and undergo some type of illness as a result. The increase in mortality, especially with coronary artery disease, is up to 25%, and the increase in mortality associated with COVID in patients with heart failure is up to 40%. So it's incredibly important that we try and mitigate anything that can expose us to this disease. I think the second most important question that I get is, should I receive the vaccine? What do you think, Charlie?
I think that certainly people in high-risk groups should have the vaccine. I think that going forward, we'll learn more about it and whether the lower risk people have the benefits. I think there are still some reservations out there on, if you do a search, it's a relatively new vaccine and a new technology, but I think that, this will evolve over time. But I think clearly high-risk people, who are at high risk for the severe forms of the disease would benefit from the vaccine.
I agree totally, Charlie. I've received both doses of the vaccine and a little bit tired after the second day, to be frank, but really back to work the day after. But I agree, Charlie. I think high-risk patients should definitely receive this, and certainly there's a public health need for a universal vaccination. I think another common question that comes up is, I am on a drug that this virus tends to impact. And this virus does tend to affect what's called the angiotensin converting enzyme, or ACE. And the database was a little confusing in the early spring of 2020. But I think the evidence now supports that if you are on an ACE inhibitor or an angiotensin receptor blocker, common drugs include lisinopril, Diavan, Cozar, or losartan, Entresto, that you should remain on these medications. They actually may be helpful in the disease, but definitely is not harmful. So the recommendation is not to discontinue this medication, even as an inpatient. Any other medications, Charlie, that you think we ought to discuss?
Yeah, those are the ones that are concerning because the way the virus enters the cell is through the angiotensin receptor on the cell. And the thought is that those drugs may affect that and make it, more likely to get into the cell. But I don't know of any other drugs that have been suspect.
Yeah, I think that the concern about blood thinners has always come up, but I think that you should definitely continue these medications even if you should be exposed to the virus. Um, the spectrum of disease associated with COVID and the heart is really quite broad, um, and probably reflecting the general impact of COVID on our patients is 40% really present with no disease, asymptomatic. 40% do present with some minor symptoms such as shortness of breath and cough, but really tend to do well. But the 20% of patients that are affected with moderate or severe disease that is most likely to be modified with a vaccine, can include more severe findings associated with the heart. Probably the most common is a elevation of a marker. We call them biomarkers. These are a blood test that we use to diagnose heart disease, specifically heart attacks, called a troponin. You all may have heard of that if you've ever presented with a heart attack and received a stent. But minor rises in troponins without evidence for a heart attack is actually quite common. Unfortunately, these patients could also present with more severe manifestations of COVID on the heart.
I can add a little bit to that. Early on, we realized that this virus affects and can be cultured from pretty much every organ in the body, from the brain to the lungs to the heart to the kidneys to the GI tract. And they actually had a series out of Germany back in the summer where they found that even in asymptomatic patients, about 60% of them had CT evidence of the typical ground glass infiltrate search physician at Scripps cry of involvement of the heart and the lining around the heart, the pericardium. We don't know what the long-term significance of these findings are, whether there's permanent damage or whether it heals. So there is a frequent involvement of the heart. Probably the most frequently involved organ is the lungs, since that's where the virus pretty much starts in the respiratory tract. But it frequently affects the heart. Fortunately, the majority of patients don't have any outward cardiovascular manifestations of the disease. So that's a good thing, but we still don't know a lot about this virus in terms of involvement and long-term effects.
Thank you, Dr. Vaughan. It's so true. There's so much that we don't know about this disease, other than the fact that as a disease entity, if you should have heart disease, that it really presents with a much more oftentimes dramatic and significant impact on you, both short and long term. An example of this is if you have heart failure, you're likely to developing severe disease, as well as suffering the ultimate consequence of any severe viral illness is markedly increased, to include the need for both a mechanical ventilator, intensive care unit stays, and again, unfortunately, death. So heart failure patients need to be especially concerned. I think not an uncommon question is, are any of these medications effective out there? I think there are many drugs that have been tested, a few that have been shown not to be as effective and possibly even dangerous. But the ones we know for sure that are very effective, Decadron, which is a steroid, which we commonly use for inflammation, and that's part of this disease process. Remdesivir is actually a drug that we actually have here at Riverside that we give routinely in patients who need oxygen. Ivermectin, which is a drug that we use for parasitic infections, can be used on a selected basis. We do have availability here at Riverside for convalescent plasma, and we're for that. And for those patients who have mild to moderate disease not requiring oxygen and can be treated as an outpatient, our monoclonal antibodies are available through Riverside. Any other thoughts, Charlie, about therapeutics?
That's pretty much it. There's the issue of the hydroxychloroquine out there that I think in a lot of people's mind is still, questionable. There are a lot of arguments that it may or may not be effective, and unfortunately, it's been politicized. But the general consensus in the medical community now is that probably doesn't add much to the treatments available.
Is there is there a subset of patients that um, don't require any therapies? And unfortunately, since 40% present with no asymptomatic and 40% present with mild symptoms, it's actually very hard to know. So getting tested is not, I've been tested more times than I'd like to tell you. A couple of kids coming home from college, and it's not an unpleasant test. So test if you're not sure. I think some questions is, if I have symptoms of heart disease, like a heart attack, should I be scared of COVID and come to the hospital for treatment? Thoughts, Charlie? Dr. Vaughan?
Oh, I think clearly in the beginning, we saw a lot of our long-term patients who were reticent to come to the emergency department because they were concerned about being exposed to the disease. And unfortunately, there are multiple studies now documenting bad outcomes in patients with strokes and heart attacks and other acute illnesses that are life-threatening who didn't come to the hospital and had bad outcomes because of the concerns. I think generally the hospitals are pretty good at protecting people, screening people, isolating people with the disease to COVID-directed floors. And so I think the hospital you're better off coming to the hospital if there's a question of what's going on. Along those lines, one of the things that we've kind of found out about this virus as we've gone along is it does seem to induce an increased risk for forming blood clots. And we actually have seen strokes and heart attacks due to acute occlusion of arteries in the brain and the heart related to heart attacks. There's an increased risk of getting blood clots in the legs and blood clots in the lungs. We're not really sure why this happens, but this is a recurring theme that we see this, we don't know why. So it can increase your risk of having a heart attack or a stroke having the disease.
Oh, that was a great point Dr. Vaughan makes about the clotting mechanism associated, or the exacerbation of clotting in patients with COVID. I think it highlights the fact that even though, we see daily statistics in the news, you see CNN and you see that box on the side of the statistics, almost like a rolling count. It really depersonalizes some of the impact. Heart disease still remains the leading cause of death in the United States. In 2020, it was number one in those patients in middle and later age, and the number one cause in patients over 85. Still behind that would be cancer, and then followed by COVID. So despite the high politicization, if you have symptoms of either a heart attack or that of a stroke, early identification and early treatment is your best bet for minimizing the impact of that disease on you both short and long term. So come to the emergency room. You will be protected here at Riverside, and we will diagnose and treat as we have for the decades prior. Dr. Vaughan?
I think one of the other things that we're kind of learning as we go along is after the acute disease, there are patients who suffer from long-term effects that we really don't understand that well: chronic fatigue, memory problems, headaches. And the one that we're starting to see in cardiology is young patients who have had the disease or tested positive for the disease without significant symptomatology. One of the ones that's kind of showing up related to the heart is POTS, postural orthostatic tachycardia syndrome. And, that's one of the reported cardiac long-term effects of the disease that's starting to show up in young, otherwise healthy people. And, they're actually developing what they call long hauler clinics that are dedicated to treating people who remain symptomatic for unknown reasons related to the disease. But that's one that we are, I feel like I've seen more of that in the office as an outpatient, and a lot of the patients don't even realize that they've had the COVID, but this may be a long-term consequence because we seem to see more of it now.
That's a great point, Dr. Vaughan. I think a common question that comes up is, the effect of any pandemic, certainly, but epidemic for sure, is that we tend not to take good care of ourselves. And I've definitely seen that. So it used to be the COVID-10, and it became the COVID 20-pound weight gain. So now that we're coming up on a year, unfortunately, I think, the understanding that this disease was a passing fancy, that 3 months from now it would be gone, maybe 6 months. Here we are a year into it, and we are destined to see the majority of 2021 to be involved. So taking good care of yourself is critical. Keeping your physician appointments, if possible, you can do a virtual visit here at Riverside. We offer that routinely, both with our primary care and our specialists. But also making sure that you eat well. So Domino's Pizza and Subway's really benefited from COVID, I'm sure. But eating healthy and daily exercise is incredibly important. Perhaps not at a gym or in a group class, but individually, I think keeping your cardiovascular fitness is incredibly important. There's certainly a relationship to a good immune response and protection with COVID. It's indirect, of course, but nothing protects your immune system better than exercise and a healthy diet.
And I think also along those lines, and not to make light of it, people are drinking more alcohol. And, and I think depression is rampant out there, is what I've observed in patients as a result of the quarantine, staying at home, particularly in our older, more frail cardiac population. And that definitely has taken its toll on people over the last year.
Carrie, Jessica, Cheryl?
Yeah, this is Carrie. I think one of the questions that we've heard, and you sort of alluded to it about the emergency symptoms or keeping your appointments, but if people develop new symptoms that aren't necessarily COVID symptoms, but something where what they used to do is now exhausting them, or they feel a flutter in their heart, what should they do if they're scared of the virus?
Charlie, do you want to take that one?
Yeah, I think that symptoms are symptoms, and I think they need to be evaluated. And I do think that, again, we've tried to make it as safe as possible coming to the doctor's office. Every patient is screened still before they come into the office, so we know the likelihood that they've been exposed or actually have the disease. And by the same token, at the hospital, we've taken pretty dramatic measures to try to limit exposure and risk. And clearly, if there are symptoms that are suspected, could be a harbinger of something significant, I think they still need to be evaluated.
I totally agree. Leading cause of death still is cardiovascular disease across almost all age groups.
Great point.
Another question, and this refers back to what you said, Dr. Vaughan, about patients who were asymptomatic but later developed symptoms. If there's patients who've tested positive and they stayed home and quarantined and felt better, is there something they should be looking out for and following up with the provider later to make sure they don't have any of these long effects that they didn't realize they were maybe susceptible to?
Well, unfortunately, we don't have any specific treatments geared toward those symptoms because we don't really understand them. But, still the vast majority, well over half patients, the disease runs its course and they have no sequelae. So, I think unless they're, symptoms that they would otherwise go see a physician for, just kind of let it run its course. And, most people completely recover from the disease.
I think what's most remarkable is how much we know about this disease and the time frame that we have here. For a disease that's only been out for basically 13 months, the database for this is incredible, but there are so many unknowns. So we are still learning about this disease and its management long term. But we do know that there are effects. This virus has a propensity for attacking the lungs, unfortunately, as well as the vascular system. And our blood vessels are the most important part of our body. It's actually the largest organ in the body, second to this, only to the skin. So we're still learning.
Yeah, I was just going to add, one of the things that I've anecdotally seen is there's really no rhyme or reason a lot of times to why people get so sick with the disease and why some don't. I've had patients, man and wife in their 80s and 90s who have comorbid conditions who have both had it and completely recovered. Yet we see patients who are relatively young who have, bad outcomes from the disease. And we still don't understand why, even, discounting the comorbidities that we typically associate with bad outcomes, those aren't always predictive of the outcomes, because we see lots of older people who bear it at home and have complete recoveries, even with the comorbid conditions. So it's a real continuum in terms of the spectrum of the disease.
So for patients who historically have had the ability to do cardiac rehab and now things are a little bit different, is that still an option for them in the facilities, or do they do that at home? Can you tell me how somebody would go about cardiac rehab?
Yeah, so that's a great question. Cardiac rehab is still available here at Riverside and in our only at Riverside Regional Medical Center. At this point, we are doing our best to protect patients both in the rehab and in the pre-evaluation. Cardiac rehab is still recommended. It's probably a fundamental part of your recovery from any cardiovascular event, whether that be a heart attack or surgery or a stent, and even congestive heart failure as a new diagnosis. It is very difficult oftentimes, I think, because we do offer these facilities that require you to park here at Riverside and potentially walk through common doorways, but I think good protective measures still recommended.
I have one more question. As we've gone through the pandemic at different times, we've had procedures delayed. And right now that's not the case, but if your procedure is delayed and we're at home waiting to have a rescheduled date, is there anything we need to be aware of or that we need to pay close attention to while we're waiting for our new date?
I'll tackle that one if you don't mind. The impact of COVID on our hospitals throughout the region, but especially here at Riverside, is the medical center for this community. We are unfortunately oftentimes at full capacity. This is not only from COVID, but also from other medical diseases. But COVID is an intensively resource draining disease. And if no beds are available and patients are waiting in the emergency room, elective procedures oftentimes are asked to be delayed if medically safe. This is something that can change, unfortunately, very quickly after even 1 or 2 holidays. A super spreader event is unfortunately not uncommon, and it can be as simple as a wedding where people have come together. So do your part, and we'll try and keep the hospital open. But being flexible is really incredibly important to allow our most critically ill to have access to the hospital.
Thank you so much, Dr. Chu and Dr. Vaughan. Appreciate all of the information you shared with us, and I have a lot to think about moving forward. Now I will turn the screen over to Dr. Alexandra Ward, who has some more information to share with us.
Thank you, Carrie. Thank you for having me talk about this very important topic. So I wanted to break down our conversation into a few different topics that are all very important, but slightly different. So first, I wanted to talk about cardiovascular complications that can occur directly as a result of COVID-19 infection. And so within that, it does break down into several different topics or to seven different complications that can occur as a result of COVID-19. So one of the things that we are seeing are arrhythmias, and those are abnormal heart rhythms. They have been seen with both atrial fibrillation. We've seen ventricular arrhythmias, such as ventricular tachycardia and ventricular fibrillation. Those are abnormal heart rhythms from the bottom chamber of the heart. Atrial fibrillation is an abnormal heart rhythm from the top chamber of the heart. It is not necessarily known why these arrhythmias or abnormal heart rhythms are being seen, but they do think it's related to the systemic stress of the infection as opposed to a direct impact on the heart itself. So just because COVID-19 causes such a big systemic infection, so much inflammation, and can be so severe in patients that people are getting these abnormal heart rhythms or arrhythmias. Additionally, COVID-19 infection can cause myocardial injury. And what that means is it means it's injury to the heart. This can be seen in a variety of ways. One is an elevation of a blood test that we do called a troponin that is found in cardiac cells and is a marker of inflammation, injury, or damage to the heart muscle. This can be seen in patients who've had heart attacks, and it is one of the ways that we measure if a patient has had a heart attack or is having a heart attack. And there's a variety of types of heart attacks. It is believed in the COVID infection that it is due to a demand issue, meaning there is a greater demand on the heart than it is able to provide, and that's what leads to this leakage of troponin. Additionally, there has been found to be inflammation of the heart or myocarditis. And you may have heard about this, especially in the young athletic population, that studies have been done that have shown that some of these patients have had inflammation of the heart or myocarditis. That is thought to be, again, an inflammatory response due to COVID-19, as opposed to an infection of the heart muscle itself. So it's due to the severe inflammatory response that the COVID-19 infection causes. In addition, there has been some studies that have shown an increase in a stress cardiomyopathy, also known as Takotsubo cardiomyopathy or quote, broken heart syndrome. That again is thought to be related to just the great deal of stress that COVID puts on the body and on the heart itself. There are no specific treatments for these types of myocardial injury unless a person is having what we think of as a classic heart attack or classic type 1 myocardial infarction. And then that would be the standard medications and cardiac catheterization. For the myocarditis, the stress cardiomyopathy, we do have medications that we can use for those. But again, it's normally related to treating COVID and dealing with the inflammatory response that the body has produced in reaction to the COVID-19 infection. Again, the normal thought with the troponin elevation is that it is not due to a classic type 1 heart attack or a big blockage in a coronary artery, but rather due to the stress and the demand on the heart. So those tend to be the cardiac complications of COVID that we are currently seeing. So again, that's the myocarditis or inflammation of the heart. Cardiomyopathies or weakening of the heart muscle is particularly a stress cardiomyopathy. Arrhythmias or abnormal heart rhythms, as well as troponin elevation as a marker of myocardial injury. So then moving on to risk factors, specifically cardiovascular risk factors that patients who develop COVID would lead to a more severe COVID case. So those would be risk factors that patients already have prior to developing COVID that if you have, put you at higher risk for having complications of COVID-19 infection. And quite a few risk factors fall into the cardiovascular realm. So that includes people with known coronary artery disease, people who've had heart attacks previously, have stents or have had bypass surgery, patients who have heart failure or a weakened heart muscle, or any cardiomyopathy, hypertension, diabetes, and vascular disease. So people with these underlying conditions are at higher risk of developing complications should they develop COVID-19. So while everyone should be especially cautious and follow current guidelines with social distancing, mask wearing, and getting the vaccine when appropriate. Patients with underlying cardiovascular disease should be particularly careful and should get the vaccine as soon as it is available to them. So I would like to now turn my attention to the younger female population, in particular the pregnant population. There have been a lot of questions regarding whether or not pregnant women should get the COVID-19 vaccine. The American College of Obstetrics and Gynecology, or ACOG, does recommend that patients who have risk factors for COVID or who otherwise would be eligible for the COVID-19 vaccine and are pregnant should get the vaccine. The initial trials that were done with the vaccines were not done on pregnant women, but there are current clinical trials happening right now that do address the pregnant population. And anecdotally, I have quite a few friends in the healthcare field, some nurses, some doctor friends who are currently pregnant, who did get the vaccine and are part of the trials. And they also do recommend that pregnant women do get the vaccine when it is available to them. There have been some studies that show that pregnancy is actually an increased risk for developing severe COVID. And on some of the risk factors for patients who would be eligible to get the vaccine between age 16 and 65 who have risk factors, pregnancy is listed as one of those risk factors. So I would have a conversation with your OB, with your family doctor, and of course your family to decide if the COVID-19 vaccine is right for you. However, it is recommended to get the COVID-19 vaccine if you are pregnant and have a reason to get it. And I would like to also address some of the misconceptions that are out there regarding COVID-19 and the current vaccine. So COVID-19 affects everybody, from infants, children, teenagers, young adults, middle-aged adults, older adults, everybody. No one is immune to getting COVID. And really, we do not know who is going to get a severe case of COVID, who will have a mild asymptomatic case. We've seen young patients who have absolutely no risk factors have severe COVID on the ventilator, and older patients with comorbidities have more mild cases. They think that that's related to the amount of virus that you are initially exposed to, called the viral load. So a higher viral load can lead to worse symptoms, more severe symptoms. And that is why social distancing, wearing masks, and getting the vaccine when you are available and eligible for the vaccine is so important, because this is really how we fight and end this pandemic. We do know that the FDA has approved the current vaccines that are in use, the Pfizer and Moderna vaccine, and we know that they are safe and effective vaccines. I know there's been a lot of questions and concerns about the vaccine and whether or not people should get the vaccine. If you have any questions or any concerns, please do not hesitate to reach out to your physician, your healthcare providers, and your medical team to discuss your concerns and to ensure that you have all the right information. Additionally, there's a lot of bad information on the internet. So the best resources are the FDA's website, the CDC, or the Center for Disease Control. And additionally, both the American Heart Association and the American College of Cardiology, so the AHA and the ACC, have wonderful information on their websites regarding COVID-19 in the cardiovascular system, and the vaccine as well. So please do look at those resources if you have any questions or concerns, in addition to talking to your healthcare providers.
Thank you, Dr. Ward. I really appreciate Dr. Ward, Dr. Vaughan, and Dr. Chu each taking time this week to pull together the information and sharing it with us tonight. Also, just want to highlight here, we have a summary slide because I know there was a lot of information shared tonight. And so hopefully this will help pull some of it together for you. But as I said earlier, it's all on video, so you can rewind and watch any portion again. I ask that you note in the bottom right-hand corner, we do have the phone numbers for both Riverside Cardiology Specialists and also for Riverside Nurse, which is our 24-hour phone line there in the bottom right corner. Next week, we will be looking at atrial fibrillation and what to do once someone has a diagnosis. I hope you will join us then and hope you have a good evening. Thank you so much. Good night.